Worldwide, every second, 4.3 babies are born. Every day, approximately 830 women die from preventable causes related to pregnancy and childbirth. 1% of all pregnancies start as extrauterine. When a woman presents herself with acute pain and/or unexpected blood loss, it's extremely valuable to confirm or exclude early and ectopic pregnancy, missed abortion, multiple gestation, molar pregnancy, or other high-risk factors. Some of these complications can be detected quite early with primary care ultrasound. In primary care obstetrics, ultrasound has a very important role in complementing physical exams and urinary tests. Visualization of the uterus and ovaries provides us immediately with a lot of the information needed. In the following lecture, Patricia Costa, sonographer and owner of EchoTune, a primary care obstetric ultrasound practice in the Netherlands, will explain how ultrasound can be applied in a primary care setting. Here you will learn to image the female pelvis and to examine the early pregnancy.
In this lecture, we will talk about ultrasound in the female pelvic. We would like to give you an overview of ultrasound advantages which can be made in primary care, especially related to early pregnancy. Pelvic discomfort or pain in the lower abdomen area is a common presenting symptom to primary care physicians. Pelvic ultrasound with a transabdominal approach is the first choice in imaging modality after the physical exam to find the cause of this situation. In which scenarios ultrasound can be useful would be urinary infections, early pregnancy, appendicitis, ovary cysts, intrauterine devices, or uterus pathology. If you're lucky, you will find a beautiful ongoing pregnancy with a nice beating heart inside the pelvic of the female. Before we're there, we need some more information about the anatomy and what's going on in the pelvic area. Let us have a closer look at the uterus anatomy. This area is the uterus. In front of the uterus, we will find the bladder. And in front of the bladder, we find the pubic bone. On the back side of the uterus, we find the rectum and, of course, the last piece of the spine. The urinary bladder can be of great value for us with ultrasound scanning, because when it's filled with urine, it makes a very good window and provides us with a better view of the uterus. If we then have a close look at the uterus in a coronal view, we see here the cervix of the uterus. On both sides, we see the fallopian tubes and the ovaries. What's the challenge about the uterus is that it can be in all different sort of positions in the pelvic. Of course, it can be in normal position, retroverted, anteverted, or retroflexed. Here I'll show you 3 images of the normal uterus. In longitudinal position and in transversal position. And here I'll show you 3 images of normal ovaries. This is the left one. This is the right one, also measured. And this is an image of the ovary where we can see in the middle a little cyst or follicle. Let me now show you how to achieve these images. To show you a transverse view of the uterus, look at the left side of this image. On the right side, you find the gray line, which is the position in the uterus where this ultrasound image is made. On the left-hand side of this slide, you will find the longitudinal view. And on the right-hand side, you see the navigation point, again in the gray stripe. Here we will find 2 images of both ovaries and, of course, the navigation point. What we have to do is find the pubic bone. Place the transducer transferred, tilt and move cranial and caudal through the uterus. Then rotate 90 degrees to a longitudinal position and tilt through the uterus. Follow the track from the left to the right iliac veins. Make sure you'll achieve a complete view of the uterus. I'm really enthusiastic that I can finally take you to the live scanning part. I'd like to show you everything I told you before in my lecture. This is going to be the fun part. For the live scanning, I'm using a handheld device. This device has a probe which you can use on both sides. This one is the linear side, and this one is the sector side. As I want to approach the uterus via the abdomen, I use today the sector side. The navigation point on the transducer is shown by a dot or by a light. In this case, it's shown by a light. We're looking at the uterus. In some cases, it's empty, but in the most lovely cases, it's filled with a baby and it's jumping around. So it's very important to know what you're doing while you're scanning. Try to have your probe always, when you look in a sagittal way, with the navigation point towards the head of the woman. That means cranial. If you rotate the transducer to a transverse view, then be aware that your navigation point is pointing to the right side of the woman. Then you're sure that in your screen, always in transverse, this is the right side and this is the left side. And if you change your transducer from transverse to longitudinal, you know that this is the head of the woman and this side is her feet. So let's start the scanning now. I'm going to put a little bit of gel on your belly. It's going to be a little bit cold. Sorry for that. Starting with the scan, I'm sure that my navigation point in a transversal plane is looking towards me. So I'm sure that it's pointing to the right side of the woman. I'll place the transducer a little bit above the pubic bone. And I start with visualizing a very nice filled bladder. As I mentioned before in my lecture, that can be very helpful because the bladder is actually working as a window now. So we know that if we scan through the bladder from caudal to cranial, that we will find the uterus. So it will be somewhere underneath the bladder. Can be in different positions, will be there. So transverse. From the caudal, here we see the vagina going to the uterus in the middle underneath the bladder. If we looked all the way up, we know now where to find the uterus, so we can rotate the transducer 90 degrees to a longitudinal plane or a sagittal plane. Again, we're tilting the transducer, but now on a horizontal axis, from the left side of the woman to the right side. That we're sure that we've seen the full uterus. This is important. Now we see the uterus and it's empty. We know that because we see the endometrium as a straight line in the middle. If there would be a pregnancy, we would see a pregnancy ring in the uterus. That means that the line, which is now straight, of the endometrium, would show us a little black hole. What we do now is moving from the uterus towards the ovaries, starting at the left side of the woman. Our navigation point is the iliac vein or artery, which you can see now on top of this image. We move a little bit towards the uterus again, and here we see, just underneath the uterus, the left ovary. That's what we are going to do on the other side as well. Again, via the bladder towards the iliac veins. Here we see them on top of the image. Sometimes ovaries are very hard to find, but the only thing that you're sure of then is that they are luckily not enlarged. I showed you now the full pelvic area. And I'm sure because I started at the left side with the iliac veins and I followed my path to the right side of the woman, again to the iliac veins. And it's important to see everything within the pelvic area. Because if you find a pregnancy, it will definitely seek your attention. The baby will be jumping around. But it's important to follow your protocol. Because it can be that there is another pregnancy, twins. Both can be in the uterus, but it's also possible that one of them is not in the uterus. That means that one of them is in the fallopian tube or in the ovary. That's dangerous for both mother and baby. Here again is a beautiful example of what we can see with primary care ultrasound. We start again straight above the pubic bone in a transversal plane, and here we see the filled bladder. This is the top of the uterus, so if we rotate now for 90 degrees, we find the full uterus. And in the middle we see an echo-dense structure which reflects strongly. This is not the endometrium. This is an intrauterine device. Because those reflections are so strong, I'm sure that's a copper spiral. What's important to know about this copper spiral in the uterus is that it's in the right position. Here we see the fundus of the uterus, and there the copper spiral is ending. So it's in the middle, looks like it's in the endometrium, so this is in the right position. I'd like to give you some take-home messages. First of all, always press firmly and use the bladder as a window. A filled bladder preferably, but if it's not filled, then just give the woman something to drink and wait for half an hour and try again. Never lose track. Always follow your protocol so that you're sure that you've seen the full pelvic area. And of course, also in obstetric ultrasound, practice is the key word. The more normal pelvic areas you've seen, the easier it gets to recognize the extraordinary. There are different scenarios in the female pelvic where we can come across with, but today we will focus on early pregnancy. I would like to introduce you to my scan protocol for early pregnancy. What I found is very important in this protocol is the counting. When we see a suspected gestational sac or pregnancy ring, we want to know for sure that it's positioned inside the uterus. If there are fetuses visible, then we count them. Count the number of beating hearts. And when a multiple gestation is seen, document the chorionicity. Confirm the gestational age of the fetus, most ideal on a crown rump length, but if that's not possible yet, then use the normal length. What I will show you here is an ultrasound video of a very early pregnancy with a little tiny fetus inside. What we can very nicely and clearly see is the beating heart in the middle of the fetus. This is a 7 weeks pregnancy. Here we see a 10 weeks pregnancy. It's stunning to see the development of this baby in only 3 weeks' time. On the right side, we actually see the baby jumping around. We see very clearly here the head of the baby, which we can follow by the spine and the beginning of feet and arms. What's very important for us to know when we visualize an early pregnancy is to see how old this baby is. The first signs of pregnancy are shown to us with a pregnancy ring. That's visible from around 5 weeks gestational age. And what we see in the uterus then is a thickened endometrium, which is caused by chorion cells. And within there is a little cavity shown, which is the pregnancy ring. Most often it's ovally shaped. We can measure that and then determine the gestational age, but that's only possible between 4 to 7 weeks of gestation. After these 7 weeks of gestation, it's only getting more exciting because what we then can visualize with an abdominal approach is a beating heart. Here in the middle of the fetus, you see a nice beating, small, tiny heart. And if we then freeze the image and measure it, we will find a length of only 2 centimeters. In this previous image, we used the length to measure the gestational age of this baby, but the most ideal way would be the crown rump length. What we need to measure the crown rump length is a sagittal cut plane through the middle of the fetus. The fetus has to be in a relaxed position and you have to be sure, so make sure the baby is jumping before relaxing again, and then you can make the perfect image. Be aware of the yolk sac and be sure that it's not in your image and definitely not in your measurement. If your measurement is not according to the first day of the last menstrual period of the woman, try to repeat it after 7 days so that you will be sure that your measurement is right. Most reliable is this measurement between 45 and 84 millimeters length of the baby. But nevertheless, it's usable till 14 weeks on. If you have done a measurement, what's important is that you use the most suitable curve for your geographic region. One which you can use and is very valuable, I think, is the one mentioned in the link below this slide. Let me show you now a couple of images where we measured the crown rump length. Here on the left side, we see a fetus in a relaxed position measured from crown to here. And we find a distance of 34.7 millimeters. That means this baby will be around 10 weeks of gestational age. On the right side, we see a much bigger fetus lying on the back. And here we see the head again with the nasal bone and the jaws measured from the crown till here, 50 millimeters. That means this baby is actually a lot bigger and almost 11 weeks old. The most important thing that we have to be aware of is the beating heart, of course. If we see a fetus and measure it, and it has a gestational age which is older than 7 weeks, then there has to be a beating heart. If not, then how unfortunately, it's a missed abortion, and we have to be aware of that. But be careful, because if there is a term discussion, which means that the baby is maybe not as old as we expected it to be, so for example 6 weeks, and we thought on the first day of the last menstrual period of the woman that it would be 10 weeks, it doesn't necessarily have to be a missed abortion. Also, if the heart is not beating, because it can be that the heart is not beating yet or that we can't visualize it. So always repeat the scan in 7 to 14 days if we're not sure about a missed abortion. We don't want to call it a missed abortion if it's a vital pregnancy. Let me show you now an example. This is an image of a 7-week-old baby with, unfortunately, no beating heart. In this example, we see a pregnancy with a gestational age of around 6 weeks. This mother had her first day of her last menstrual period much earlier, so we thought she would be 8 to 9 weeks. This could look as a missed abortion, but we're not sure, because maybe the heart isn't beating yet. So also this exam we want to do again in 7 to 14 days. A missed abortion is a very sad scenario, which causes very emotional stress with the parents-to-be. But clinically, we don't have to do much about it, because in most cases, the body of the women will take care of it themselves. What is really important and what we have to be aware of always is a pregnancy which is not located inside the uterus. An extrauterine gravity can cause lots of pain, blood loss, and all different sorts of complaints from the woman. What's even more important to know is that in about 50% of those cases, women don't complain at all. They don't show any risk factors. It's just there. And what we have to keep in mind is that when we see a vital pregnancy in the uterus, it's always possible that it is a twin and that the other one is not positioned in the uterus, but outside the uterus. So again, coming back to the scan protocol, always use the full protocol and always scan the full length from left to right and from cranial to caudal, so that you're sure that you've seen everything. We see the uterus here on the left side. And it looks that the endometrium is closed and that there are no signs of any pregnancy. But that was weird, because this woman who came in had her first menstrual period around 9 to 10 weeks ago. She did a pregnancy test, which was positive. So then you go on and look further on in the abdomen, because it's not possible that you have a positive pregnancy test and it's not showing any pregnancy. If you see now here on the right side, this is ovary tissue. And within the ovary, we found, unfortunately, a fetus with a beating heart. This is a very, very sad case because if we don't do anything about this pregnancy, the woman will have very severe pain and internal bleeding, and this baby can't survive. So be aware that you always look through the whole uterus, the whole lower abdomen, and be sure that there is nothing going on in the ovary that doesn't belong there. Luckily, all these scenarios are rare, and mostly you will just find a normal, healthy pregnancy. But sometimes you're lucky and you will find twins or maybe triplets. If you find a multiple pregnancy, then it's even more important to use the regular scan protocol. And what you do then is add the counting. To go back to the counting, what are we counting then? We count the number of fetuses, 1, 2, 3, or even more. And count the number of beating hearts, because we want them all to be vital. Document the chorionicity and confirm the gestational age of all the fetuses. Here we see a multiple pregnancy, a triplet on the right side. That's rare, but it's funny to see. What we want to know then, which is important for the risk factors of this pregnancy, is how are those fetuses divided? How thick is the tissue in between? We call that chorionicity. If they have just one, then it's monochorial, and then we see it as a T sign. If they have 2 layers of tissue in between, then we call it dichorial, and then we have the lambda sign. To show and explain you a bit further, I will give you the following images. On the right-hand side here, you see the T sign and the lambda sign from the Greek lambda letter. And in the images on the left side, here you see the wall of the uterus with the T sign. And here we see the wall of the uterus with the lambda sign. This is very rare. And the best thing to do as soon as you see it, please refer to a gynecology department, because this woman with her babies need extra care. What other things can we come across in our practice? That's, for example, an intrauterine device. In most countries, general practitioners can place them by themselves, but what do they look like if you want to see if it's in the right position? For a device with hormones, it's not very important to check, but with a copper spiral, you want to be sure that it's in the right position. Here we see a couple of images with a copper spiral inside the uterus. This is the transverse view. We see the beginning of the fallopian tubes, that's why we recognize them. And we see a straight line of the top of the copper spiral. This is the longitudinal, and we see the copper spiral in the middle of the endometrium. And luckily, at this woman, we could also visualize the coronal plane. That's rare, you don't need to do that. But it's funny to see that you see the full T shape of the copper spiral. We just showed you in this lecture a few different stages of pregnancy, how you'll recognize them and what they look like in a healthy pregnancy. But also some cases where you have to pay full attention on little subtleties, which will make a huge difference in good quality healthcare. In my opinion, it's very valuable that we make a proper first trimester scan. This can make a real difference in good primary care. You win time if extra care is needed, but most important, you will give confidence, faith, and minimize stress early in a very exciting phase of a woman's life.